So, Dr. Shapiro, why is IBS so difficult to diagnose? Why is it so difficult for a doctor and a patient to often come up with that diagnosis?
Dr. Ashwan, thank you. That's a very commonly asked question. What is the test for this? How do we know this is it? And one of the reasons that it is so difficult is that there's not a single test to make a diagnosis of irritable bowel syndrome. And so historically, it was treated as what we call a diagnosis of exclusion. You have to go rule out everything else that this could be, and then we'll call it irritable bowel syndrome. And one of the things that we've realized over time is that most patients actually don't need a lot of testing if they have the classic symptoms. Um, they don't need much more than a good history and a doctor who takes a thorough history from them about their symptoms. There are some other conditions that can have overlapping symptoms with irritable bowel syndrome. Ulcerative colitis and Crohn's disease, which make up the inflammatory bowel diseases, or IBD, which is often confused with IBS, and is a very different set of conditions where there are ulcers and inflammation in the intestines. Endometriosis, celiac disease, those are all conditions, and there are many others that may have some of the features of IBS, like pain or change in bowel movements, but are not from IBS. And so, those are the conditions, or there's specific ones that we know it's important to rule out. But then once we settle on a diagnosis of IBS based on history and some very selective testing that we'll talk more about in subsequent videos, we can be confident that that is the diagnosis. And what I always like to recommend to my patients is, once we settle on the diagnosis, plan to start treating it as such. It's never permission to stop thinking. So if things change, sometimes you need to reevaluate other conditions. And we know that patients where we make a diagnosis of IBS, the likelihood of that diagnosis changing downstream is very, very unlikely. So those are a few of the tips I would say with respect to why it's so difficult to diagnose IBS.